we develop chronic pain because we're not really listening to the underlying cause. And this is where I think the solutions become so powerful, because if we can determine which one of those is the primary issue, we can treat the cause, not just the symptom.
Hey guys, welcome to the Healing Reset Podcast, a place where we aim to provide hope and true healing from chronic suffering by talking to experts on how to treat your whole body, not just your symptoms. Contrary to modern day belief, your body is designed to heal. I'm Jess, your host. Today we have on Dr. Kirk Wersland, here to speak with us about musculoskeletal conditions and the chronic pain that you often have from those issues. This includes, but is not limited to, just severe ongoing body pain. So listen up, guys. His clinic in Utah, Integrated Wellness, uses a unique approach that combines modern medicine and scientific research and, the kicker, natural healing methods. His desire is always to uncover the root cause of your illness. He really believes that healthcare this day should really be root cause based. So Dr. Kirk, I'll let you explain a little bit more about that, but welcome to the show.
Thank you. Thank you. It's an honor to be a part of your team. And I'm always passionate about sharing the story and helping people find hope and healing in a much better solution to healthcare.
As I was reading a little bit about you and your clinic, passion is a word that just kind of like ekes out of everything I read when it comes to you, whether it's around health or working alongside of people to not only just like get them well, but educate them on what wellness can look like long term. And I think that's such a beautiful gift that you can give your patients and the listeners out here. So if you don't mind, briefly dive into your story. What made you hop into, I'm going to call it root cause, or we can often call it integrative medicine?
Well, I've been in this industry now for almost 24 years or so. And as I've done this and interacted with many others who are passionately trying to help make an influence in this world of health and healing, natural, holistic approach to health and healing, most of us, I find, had a personal experience that brought us into this industry. Mine happened when I was about 14, 15 years old. I was a gymnast and performing at a very high level. Went to nationals a couple of times. And one time at practice, I was doing giants on the high bar and flipped off because one of my leather grips ripped and went flying. And talk about musculoskeletal injury.
Mm-hmm.
Knocked me out. I had a multiple series of different things. I was injured and at the hospital, University of Utah Hospital for quite some time. And to try to be brief of a long story, the short story is I went through the traditional route as a result of the head trauma and concussion and so forth. I ended up having significant seizures and my health just plummeted. I lived on drugs for 3 or 4 years, which just sucked the life out of me until finally my parents decided, you know what, let's look outside the box. And I was introduced to a chiropractor who was a functional medicine type provider way back then. And through nutrition, chiropractic, biomechanics, acupuncture, got introduced to some of this holistic approach. And rapidly, within a period of 6 months, my life changed. Seizures went away. And I knew when I was 16 years old what I wanted to do because it changed my life. So that has driven me now for over 2 decades in trying to help mentor and teach and coach and provide people a better path than your traditional healthcare route of, a script for a symptom versus really getting to the underlying cause, which in my case was a combination of significant nutritional deficiency along with some musculoskeletal significant traumas and neurological damage that through natural healing changed my life, turned my life around and gave me a new hope.
Well, with the, diagnosis of seizures, a lot of times that's a lifelong medication that you will be prescribed if you don't find a way to look at this from a different angle. And that's not to say someone out there that's on an anti-seizure medication right now, that's not a need.
Yeah.
I don't want to mix my words here with saying this, but oftentimes you meet the right person at the right time, that clinic, and then you learn that your body is trying to send off these alarms of, hey, I need more nutrition. I need you to look at me from a different angle. This is all from one trauma event. And I love that you not only took that, but from what I've learned about you, you've modeled your clinic very similar after the experience. Someone doesn't just come to you and get chiropractic. They come to you and they have a functional medicine. They have physical therapy. What else do you guys offer?
Well, so I like to, for patient's sake or for simplicity's sake, we have two categories, if you will. We operate and provide what's called physical medicine, and then we also offer what's called functional medicine. Physical medicine really is the diagnostic, assessing, evaluation to get to the underlying core and cause of musculoskeletal disorders and conditions that causes chronic pain. Functional medicine in its approach is really looking at primarily the systems, the systemic systems, your endocrine system, your respiratory system, your cardiovascular system, and so forth. So the musculoskeletal system is one of 11 different systems. I think functional medicine in its truest approach is really looking at, it's like lifting up the hood to your car, versus just looking at the beauty of the outside, lifting up the hood and really diving in and understanding mechanics. Functional medicine, I think, really is looking at all the different balances of all of the systems that are required to find homeostasis that perpetuates health and wellness.
Mm-hmm. And again, the homeostasis, you guys, is just equating to that balance we often talk about, bringing our bodies back into balance. Today, we're really going to focus on the physical aspect of healing. And so can you describe musculoskeletal condition is a pretty broad term. And listeners out there might be like, I don't have that, or I don't know anyone with that, but it really encompasses a lot of different conditions. So can you describe what that includes?
Absolutely. In fact, because it is an extremely complex system, over the years, I've been able to really help define a simple way of describing what that really is. The musculoskeletal system is founded on 4 key components. The first are bones, our skeletal system, the bones and how they all play a specific role. The second is what I like to just call white tissue. White tissues are things like ligaments, tendons, discs, connective tissue, fascia, bursa, etc. And they all have different purposes, but they work in unison together. And if you dissected your body, they would look white. The third one is what I like to call red tissue. Red tissues are muscles. Muscles specifically have a very distinct purpose as well. And again, if you dissected it, it would look red. So to keep it simple, bones, white tissue, red tissue. And then we know, especially in this world of physical and functional medicine, the nervous system plays a significant role in everything. So the nervous system has a specific role in that. And when you take those 4 components and put them all together, that is what really is the musculoskeletal system. It's the frame, the body, and all of the tissues that support our mechanical physiology and movement of function. Now, if I can, because you can't tell I'm a little passionate about this, but I'll tell you just real quickly, each of them have a distinct purpose. And Jessica, if I can share this, as I think we highlight this, you know that our number one purpose in true holistic healthcare, functional medicine, is to really ask the question, why, not just what.
Mm-hmm.
I think in traditional medicine, that is what really distinguishes healthcare in this functional medicine world versus the traditional approach. All is in the question. I think in traditional medicine, the physician is primarily trained to ask the question, what? And you could follow that up with, what is the condition? What is the diagnosis?
Now, I want to interject there because people will be familiar with diagnosis codes, right?
Yeah.
ICD-10 codes. It's not, why do you have this? It is, what am I checking off on the sheet that shows what you have and
Yeah.
how I'm treating it?
Yeah. And unfortunately, again, because of how that system works, it's the what, i.e., the diagnosis, that drives the treatment.
Mm-hmm.
And 9 times out of 10, it's the diagnosis that drives a drug or a specific surgery or further high level testing that's just expensive as heck to determine exactly how to treat it or what medication to take. Whereas in true functional medicine, a physician is trained to ask the question, why? Okay, yes, you have bursitis in your shoulder, for example. Why? Well, this is a simple, easy way to understand our approach. When we look at the big picture, it's looking at these four things because each of them have a distinct purpose. And when we can understand why each purpose plays its role, it's easier for us to be able to determine which one of those four things is the problem. Because if we just rub-a-dub muscles for pain, but the real problem might be in the nervous system or in the deep connective tissue, the solution is going to be very short term,
Mm-hmm.
just as an example. So each of those have very distinct purposes. Our skeletal system has a primary purpose that is to share loads. The better our body distributes loads through all the joints of our body, the better we function. So anytime we have a significantly distorted load in a joint, you can be assured sooner or later it's going to become a problem. Does that
Now,
make
with
sense?
that, you can almost refer right back to the bursitis issue, correct? Or does that have to do
Correct.
with your
Yeah.
arthritic patients as well?
That's going to lead right into that. That's a perfect tee up for the rest of this because when the skeletal system is sharing loads, it allows the rest of the systems to do their job. So remember, the next system I talked about was white tissue. White tissues are things like ligaments, tendons, discs, and all of the connective tissues. It's in essence the tissues that stabilize the bones. That's what holds us together so that we can keep our bones together. Ironically, tomorrow's Halloween, right? So we're going to see all these skeletons out there. Well, if bones were just moving around, we flippity flop with zero stability. The stability comes from all of that connective tissue. Then we have the red tissue that I mentioned. Red tissues are muscles, and muscles' primary purpose is to move us with power. Well, those muscles can only do that if we have a stable joint and a shared load appropriately into the joint. Now, the nervous system's responsibility in all of this, Jessica, is to balance. It's to maintain this neutral balance and constantly regulate how and where and what we're doing in gravity to assure that we're creating this balance.
Mm-hmm.
So to get to this bursitis concept, here's what typically happens. More often than not, unless there's a traumatic injury, right? Today, I think we're primarily talking about chronic pain.
Yeah.
So when there's a traumatic injury, what happens is we damage the joint that causes inflammation into the tissues, and muscles will splint to protect. That causes the nervous system to say, help.
Yeah. Hey, I'm on
Right?
fire.
Help. But in a chronic situation, if we have a shoulder, for example, that isn't appropriately sharing the load as it moves through that pattern, what it does is it starts to create constant tension and torque into the connective tissue. In medical terms, when that connective tissue is chronically inflamed, guess what we call it? We call it itis.
Mm-hmm.
Itis is just chronic inflammation. So we get bursitis, we get arthritis, we get tendonitis. And 9 times out of 10, all that is it's a tendon that's chronically inflamed. Now, in the traditional medical approach, that's the diagnosis. Oh, you've got shoulder bursitis. Yeah, but the real question is why? Right? Why? Why is my bursa chronically inflamed? And what happens is eventually a lot of the pain, Jessica, comes from the muscles that act as the final backup system to splint to protect. And when a muscle splints like that to protect, guess what you feel?
Pain.
Starts with a P and sounds like ain. Exactly. We feel pain. And that's what alerts the nervous system to say, help, help, help. Now, when we continue to ignore that system, or we keep taking ibuprofen, or we take Tylenol, or we take, some kind of pain med, all we're really doing is telling the system to shut up. It's not really addressing the cause. And so when that system is continually out of sorts, we develop chronic pain because we're not really listening to the underlying cause. And this is where I think the solutions become so powerful, because if we can determine which one of those is the primary issue, we can treat the cause, not just the symptom.
So it's intriguing to me because I had bursitis myself growing up. I had pain medication put on board, cortisone shots. I had cortisone shots. Not a lot of emphasis on anything other than, and I didn't have a gut or an intuitive feel on what my body needed at that age. I was quite young. But bottom line, this is a very relatable topic, and not everyone's experienced bursitis, but when we start talking about arthritis, when I start thinking about chronic back pain, this is something every listener out there knows someone, knee, joint pain, that could benefit from the thought process of, hey, we've got 4 simple ways to think about this. They're all intertwined. Why? And I could go back to my 17-year-old self, and I know why now, looking back on it, but I wasn't asking those questions. And it's a beautiful message to put out to our listeners right now who are maybe a little skeptical of, just start checking in with your body and asking why. And then when we're staying in front of our doctors, whether it's conventional or even on the functional side, make sure those questions, that dialogue is happening, and that we're not just putting a Band-Aid to something that is never truly getting to health. So let's talk about healing and health and the hope that a skeptic out there might have. What do you do if someone walks in chronic back pain, years, right? They just live with chronic back pain. They live with chronic shoulder pain. I imagine that's a hopeless place to be. And you see these people and they're greeted with your passion and your intensity and are like, no, doc. Cool. I want to give this a try, but good luck.
Right. Well, I think that the coolest thing about even what I've just shared with you is when patients are empowered, knowledge is power.
Yes.
And too often, that's the biggest hurdle is in conventional medicine. We're not really given the opportunity to ask questions. It's simply, oh, yeah, here's your diagnosis, here's your script, and here's your solution.
I want the listeners out there who have not been to a functional medicine doctor, integrative approach doctor, I want them to think the last time they actually questioned the white coat. When's the last time you questioned the white coat? Think about that. And it's not that you don't have a humble doctor who's doing the best they can for you. But
sure.
Knowledge is power, and you are ultimately the most knowledgeable about you. And so what you're talking about right now, I think, is just highly impactful.
Well, thank you. I really feel like in this holistic approach, as a functional medicine or physical medicine, musculoskeletal physician, I feel like my role as a physician, number one and first and foremost, is to educate. I'm an educator first, and then second, doctor. So that's why I feel, again, this 4-step process to everything. When someone comes in and they've been suffering, as you indicated, chronic pain, and they've tried everything. They've done injections and they've done even surgery in some cases. It's very, very, very empowering when I can sit down with a patient. And yesterday I had a perfect example. Older individual, male, who had been dealing with chronic lower back pain. Was in the military, had been through a host of different things. I mean, they've tried everything. He's had surgery, he's had this, that, and the other. And he's just been told that he's got scoliosis and curvature, and that's just part of his genetic makeup. as we did his exam and sat down and looked at his x-rays, because he was finally fed up with what he'd been told, he was following his gut and felt there's got to be something that's causing this. Why at my age am I feeling this? And so he's looking for solutions. Well, when we sat down and looked at his x-rays and showed him and talked about these first four, what we found is his skeletal system was completely shifted and out of, quote unquote, in a distorted load, because he had a significantly genetic short leg.
That was never caught?
That no one had ever really even seen. They just kept looking at his spine where his pain was, that was curved. Well, the cause of the curve of that spine was because his foundation was shifted. So looking at that first thing, that skeletal system was completely imbalanced. And so the nervous system was trying to respond by just trying to balance and keep your head over his pelvis. Guess what develops as a result?
The
Curves. This curvature and distress. And what that facilitates, Jessica, is a significant distorted load. So his pelvis rotates and his rib cage rotates, and you get all of this torque and tension that's constantly compressing the lower back. And then you take activities of bending, lifting, twisting, and physical work, and where do you think it's going to continue to cause chronic inflammation? Well, we develop distorted loads. What do you think happens to all the soft tissue in that area? The discs, the cartilage, the ligaments, they all become distorted, chronically inflamed itis. And inflamed, and then the muscles of the whole core and lower back are working 10 times harder because they have to do the stabilizing job instead of just the moving job. And those muscles that should be nice and hydrated and look like almost a piece of steak before you barbecue it, they end up turning into jerky, stiff, rigid, tight, toxic, and painful.
Yeah.
And the nervous system is on constant alert. And we were able to allow him to see that. And it was like the light turned on. Holy cow. So if I could maybe balance that load, could everything shift? Well, the answer is yes, it can. Now, it doesn't happen like that, but we can see and address the cause instead of continuing to inject where the pain is with cortisone shots. We can actually balance the structure and work with the system to get it all balanced so that things are shared, loads are shared, connective tissues can now stabilize instead of being pissed off all the time. Muscles can move us instead of being in a state of, oh my gosh. And the nervous system goes, ah. Now, I think, Jess, you might probably ask the question, but I believe we wanted to talk about some of the treatments that we offer that might help in that regard, like the ozone.
100%. So I want to talk about treatments, but before that, with that patient, a lot of times just seeing that and having that light bulb moment that you speak of, that provides light at the end of the tunnel, that I don't have to live out the next 30 years, the next 50 years. And someone out there listening is thinking this right now. This is just my sentence. This is my diagnosis, my life sentence. I don't have to live out the next 30 years in pain. It just provides that glimmer of, hey, I could heal. And what a beautiful thing, because you asked the question, why? And you dug deeper than a curvature behind the spine. Well, why? Why? And so super cool. Yeah. I do want to talk about some tools that you use that can be applied to, right, the bursitis. So bursitis guys out there, shoulder pain, someone with the back pain, knee joints. You just talk about like blunt trauma, chronic pain. I know a lot of those can be applicable to the body in general and supportive in nature. So yeah, let's dive in. So you have that patient right now. We can just stick with him with the back pain.
Yeah.
Where do you go?
So perfect. He's obviously dealing now with a chronic condition, because this is something, I mean, this guy is in his late 60s. Right? I mean, he's been dealing with this short leg since he stopped growing. Who knows? Maybe he was 15, 16, 17 years old by the time his bony structure ended growing. So now he's got years of this, years of all of this distorted load, chronic inflammation into that tissue, itis, and muscles now that have turned into jerky instead of nice, healthy steak. And the nervous system that has completely adapted to that and feels like, okay, I guess this is just where we're going to live.
Yeah.
So the first thing that we address with this is the most important thing, Jessica, is tissue healing. Now, what's really so cool in functional medicine is, as you started this whole thing out with, is we all strongly believe and know, and science proves, our body was designed to heal itself. And the coolest thing when it comes to musculoskeletal disorders like this low back pain, chronic inflammation, itis, discogenic stuff is all we're doing is taking natural derived biological products that our body already produces and being able to, in a natural, healthy way, concentrate them and push them into the areas that just need it to help accelerate tissue healing. For example, one of the first things we've recommended for him are ozone, or what we call prolozone injections. This is a combination of ozone, which is excited oxygen, and cobalamin. We combine cobalamin. Cobalamin is a big term for B12. I think everybody's kind of heard of B12 before.
Yes.
Well, B12 is a nutrient and a building block of repairing tissue that our body already naturally produces. Ozone is excited oxygen. Now, in the air, we get oxygen, which is O2. We get O3 in the system, and we get this excited oxygen. Now, for just the basic lay person out there, a simple example is I'm a sports guy. I played sports all growing up. If you've ever watched football, you see a guy catch a kickoff return. He runs 100 yards. He scores a touchdown. The camera stays on him, and he runs off to the sideline, gives all of his buddies a high five, and he sits down and he goes, and he's got a mask on. Why does he do that? Well, he's not going to die. We're not trying to save his life. But he's got this little mask, and you know what he's doing? He's breathing in O3. It's excited oxygen. And when that molecule gets into the lungs and is pushed out to the blood system, his recovery from that 100-yard sprint is instant. He's able to take 5 to 6 different breaths of that, and it gets into his bloodstream, and his heart rate goes, ooh, and he's able to hop back out on the field like it never happened. Whereas otherwise, it might take him 3 to 5 minutes for his full body to fully recover. So ozone is just a molecule that we get into our system and can help excite and accelerate tissue healing. So if I can take that excited oxygen and cobalamin and push it down into the tissues of this guy's lower back, into the muscle, deep into the ligaments, what do you think is going to happen? The body goes, oh my gosh. And we start to help accelerate this tissue healing. Jerky turns into steak. Itis turns into normal. And it accelerates the tissue healing while we start to create mobility and balancing the structure.
You know, I love that so much is oftentimes there's a little bit of hesitancy from someone when it comes to something they're unfamiliar with. So ozone isn't something that a lot of our listeners have interacted with. And a couple of weeks ago, I was talking with Dr. Minkoff, and he was saying, I do the same thing for my elite athletes as I'm doing for chronic pain. And you're painting the exact same picture of this is something that supports us, whether we are if we're looking at red tissue, white tissue, skeleton, nervous, whether that's functioning perfectly, I guess, functioning healthily or optimally or just dysfunctional. And we can use it on both.
Yeah.
And you see awesome results, but we really are focused on this chronic pain, guys, and it's amazing. So talk about that. Is that we said, this specific example, this guy's been dealing with this since he stopped growing. He's in his 60s. So I assume it's not just one Prolo shot done.
Oh, yeah, Jessica, that's a great point. With this guy, when we look at these kinds of conditions, I kind of look at it in a simple way. Bad, worse, and worstest.
I like that.
And depending upon the length of time, the amount of degenerative changes, the amount of arthritis and inflammatory stuff, each of those levels, bad, worse, or worstest, are going to require more treatment than the others, right?
Yeah.
Just commonly makes sense. Well, with a chronic condition like this, our process for him is intermittently a combination of physical therapy, chiropractic care, nutritional supplementation to help in enhancing the healing at the biochemical level. And then the sequencing of modalities that we're providing, the sequence of the injections that we're providing. And there's nothing greater when it comes to musculoskeletal disorders than facilitating optimal movement. Motion is lotion. There's my one-liner. Motion is lotion. And believe it or not, when our joints are moving at their optimal level, the Nobel Prize recipient on brain research in 2007, and I believe in 1997, Dr. Roger Sperry indicated that 90% of the brain's nutrition comes from motion. When we're moving, it stimulates our brain with function and neural stimulus that keeps us healthy and alert. When we're sedentary and not moving, the system shuts down and our nervous system deteriorates and we age prematurely. That's a documented fact now.
And tell me this, Dr. Kirk, you're speaking to generations of TV culture, phone culture, right? We're sitters. What's your prescription for someone who can, obviously, we're talking chronic pain. So sometimes you do have to get someone in an optimal place to be able to start movement. And for listeners out there, there's a grace with where you're at right now. Believe me, we want to get you to that place of motion is lotion. I almost reversed that there.
Yeah. But motion is lotion.
Motion is lotion. But what's your prescription? So what's the ideal?
Okay, that's a great question. Here's another one-liner you'll hear from me all the time. Inch by inch is a cinch, yard by yard is hard. The bottom line is the worstest situations need to take baby steps, little by little, little by little. I'll use just an example. I grew up in a family of a bunch of boys, and my dad taught me how to work. He had a workbench out in his garage, and he had a whole workbench full of tools. Well, one winter, that toolbox, so it was metal, got all rusty. And the crescent wrenches that used to be nice and shiny and pretty turned into this rusty, moldy gunk. And I thought, as a little kid, being pretty ignorant, I thought, oh, crap, Dad's going to be ticked off. He's going to throw them away and be all upset. What a waste of money. Well, no, my dad was pretty smart. He grabbed a towel, put it out on his table, laid those things out there, grabbed some lubrication or WD-40, sprayed it, and worked the gears. And then let it sit for a day, and then sprayed it again and worked the gears, and sprayed it again and worked the gears. And little by little, over about a week and a half of my dad repetitively doing it in that sequence, all of a sudden there were these bright, shiny new wrenches. Well, that same thing can be done with our body.
It can turn the jerky into a steak, right?
We can turn the jerky into steak, and we can turn arthritis and degenerative joints slowly but surely with lubrication and nutrients and proper motion to flush out the toxins and get that stuff moving. Movement and nutrients and movement. Proper, appropriate inch by inch is a cinch, yard by yard is hard. And little by little, yes, those joints can all of a sudden revitalize. When they're not moving, the body doesn't get the stimulus to infiltrate the nutrients necessary to keep it healthy. When they're stuck and fixated, that's why motion is lotion. Slowly beginning to restore that. Now, the nutrients, the prolozone that I shared with you, pushing that right into there is the fastest, most accelerated way to get those nutrients in there.
So on average, how many Prolo shots would someone have to?
Yeah, that's a good question. We typically, on a chronic condition like this, we may recommend anywhere from 3 to 6, once to twice a week for the first 3 to 4 weeks of their care, intermittently with all the physical therapy and rehabilitation and so forth.
I was going to just interject that same point of, I don't want that to sound like that alone is going to do it. From what I hear you saying, it is a commitment. Someone is signing up to say, I'm going to do A, B, C, and D to help support this physical medicine process.
Yeah. Thank you for pointing that out. Because I tell you, unfortunately, in our culture, we're kind of ingrained because of our conventional medicine approach. Like you mentioned earlier, the cortisone shot. Our impression is a shot is supposed to provide me instant gratification. These types of healthy injections, there's no instant gratification. Now, believe it or not, we actually do see some of that sometimes. But what we're doing is trying to accelerate the body's natural healing mechanisms to perpetuate the healing process. So it is all it's doing is, that's the key word, I think, is we're using cutting edge technology to accelerate the body's natural healing capacity to be able to make the healing happen in this amount of time instead of a long time.
Mm-hmm. So interesting. And guys, for the listeners out there, ask why. This all goes back to asking why. So, Dr.
Right.
Kirk, I end every podcast with something I think is just vitally important. If there's a listener out there that wants to know 3 things they can do this second, right? They shut this podcast down and they can run out in their day and change 3 things to implement better health. Any ideas?
Great. Yes. Get good sleep. 2, hydrate. 3, move. Motion is lotion. Hydration is the key to optimal nutrition. And if you're not getting enough rest, your system is not able to recycle. And those 3 things, I think, now there's others, but if you're giving me just 3 to choose, those would be the 3 I would say. Get doing those, because without those, you're going to develop a host of other conditions that are going to perpetuate illness and disease. These will help perpetuate health and wellness.
So, where can we find you? Where can listeners out there go and get more information from Dr. Kirk?
You can find me at our, just go to our website, www.bountifulwellgroup.com. Right there, you can click on my link, my page. My email is in there. Love to help. I've been doing this now for over 2 decades. And my purpose now in this phase of my life is really to help mentor, teach, coach, inspire, and really make some significant changes in not only people, but other physicians that are looking for cutting edge solutions.
Thanks for partnering with the Healing Reset. We just appreciate your wisdom and your passion behind helping people get well. It's amazing. Thank you.
It's been a pleasure. I look forward to maybe joining you sometime in the future. Thanks, Jessica.
Yes, come back. All right. See ya.